Fatty liver disease is becoming increasingly common in many parts of the world, affecting about 25% of people globally. It is linked to obesity, type 2 diabetes and other disorders characterized by insulin resistance. What's more, if fatty liver isn't addressed, it may progress to more serious liver disease and other health problems. What is fatty liver? Fatty liver occurs when too much fat builds up in liver cells. Although it is normal to have a tiny amount of fat in these cells, the liver is considered fatty if more than 5% of it is fat. While drinking too much alcohol can lead to fatty liver, in many cases it does not play a role. A number of fatty liver conditions fall under the broad category of non-alcoholic liver disease, NAFLD, which is the most common liver disease in adults and children in Western countries. Non-alcoholic fatty liver, NAFL, is the initial, reversible stage of liver disease. Unfortunately, it often goes undiagnosed. Over time, NAFL may lead to a more serious liver condition known as non-alcoholic steatohepatitis, or NASH. NASH involves greater fat accumulation and inflammation that damages the liver cells. This can lead to fibrosis, or scar tissue, as liver cells are repeatedly injured and die off. Unfortunately, it is difficult to predict whether fatty liver will progress to NASH, which greatly increases the risk of cirrhosis and liver cancer. What causes fatty liver? There are several factors that may cause or contribute to developing fatty liver. Obesity. Obesity involves low-grade inflammation that may promote liver fat storage. It's estimated that 30 to 90% of obese adults have NAFLD, and it's increasing in children due to the childhood obesity epidemic. Excess belly fat. Normal weight people may develop fatty liver if they are viscerally obese, meaning they carry too much fat around the waist. Insulin resistance. Insulin resistance and high insulin levels have been shown to increase liver fat storage in people with type 2 diabetes and metabolic syndrome. High intake of refined carbs. Frequent intake of refined carbs promotes liver fat storage, especially when high amounts are consumed by overweight or insulin-resistant individuals. Sugary beverage consumption. Sugar-sweetened beverages like soda and energy drinks are high in fructose, which has been shown to drive liver fat accumulation in children and adults. Impaired gut health. Recent research suggests that having an imbalance in gut bacteria, problems with gut barrier function or other gut health issues may contribute to NAFLD development. Symptoms of fatty liver: fatigue and weakness, slight pain or fullness in the right or center abdominal area, elevated levels of liver enzymes, including AST and ALT, elevated insulin levels and elevated triglyceride levels. Thanks for watching this video.